This is a case of a 64-year-old male with pain in the left elbow for about 4 months. He works as a mechanic using his upper extremities quite often. We went ahead and did an ultrasound guided needle tenotomy / platelet-rich plasma injection in the left common extensor tendon. Patient also had calcification proximally in the common extensor tendon, which was just superficial to the intrasubstance tear. We went ahead and did a platelet-rich plasma injection / needle fenestration of the common extensor tendon, which provided essentially complete relief for the patient.
Here we're going to run through a platelet-rich plasma injection of the common extensor tendon. Here's some of the musculature of the dorsal aspect of the forearm. And here we are rotating on the volar aspect, where you can see palmaris longus and the underlying flexor tendons and musculature. Also, you can see here the biceps muscle. Here again, we're rotating towards that lateral epicondyle, where you can see all the muscles that insert on that lateral epicondyle. Now we're removing the muscles, and you can see the ligaments of the lateral aspect of the elbow. And now we're rotating. And here we're just focusing again on the capsule. Here you can see we're zooming in on the annular ligament over the radial head. And here you can see the lateral collateral ligament and the lateral ulnar collateral ligament coming in as well. And now we're putting back the muscles of the extensor compartment. And now we're going to rotate the upper extremity into the position of the procedure. And here we're going to focus in on the common extensor tendons. The most commonly involved tendon is the extensor carpi radialis brevis tendon. And here we're going to make these tendons thickened, consistent with tendinosis, which this patient has, as well as an intrasubstance tear of the extensor carpi radialis tendon with some calcification proximally, which you can see here. And the needle is essentially focused towards that calcification, going into the proximal aspect of the common extensor tendon. Here we're doing a fenestration prior to the PRP injection, in line with the fibers of the tendons. And now we're injecting PRP into the torn aspect of the tendon and the tendinotic part of the tendon as well.
So our patient, 64-year-old male with a tennis elbow based on clinical exam. We're going to go ahead and do a platelet-rich plasma injection. So history is basically 4 months of pain or the lateral epicondyle when he lifts objects. There's no injury, but he does work as a machine mechanic, obviously using his hands quite often. You can see a little fluid collection here with basically he does have intrasubstance tearing within that common extensor tendon with calcification above it. And here you can see calcification within the distal common extensor tendon. We are going basically towards the kind of the radial aspect of it. Radial head and capitum, you can see that calcium come into play. And as we go ulnar, flip again, so you can see that calcification going. The lateral collateral ligament here looks okay. And here you can see the lateral collateral ligament underneath the common extensor tendon, and you can clearly see the tear as well within the common extensor tendon. I'm going to do a quick axial view here of it. Turn my probe. The left side of the screen is radial. And here's that large brachioradialis muscle just next to the lateral epicondyle. It inserts above that, however, on the distal humerus. You can see that calcification with fluid around it and underneath it. Here again is that intrasubstance calcification right superficial to the intrasubstance tear. Here we are, we're starting our PRP injection. Initially we do a needle fenestration of the common extensor tendon where he is tender. Alright, this is me. I'm just kind of going into that calcium deposit. I'm also trying to break up the calcium deposit as well. And there you can see the needle heading towards the intrasubstance calcification, which I'm trying to break up with the needle. And we're getting close to the lateral epicondyle. And it's good just to get close to the bone because it stimulates more of a healing response. Okay. Okay, now I'm going to inject a little bit of the PRP. So here we are injecting PRP. Initially I like to inject superficial to the tendon as it's less painful, and then towards the end I inject it within the tendon tear itself, if possible. Here we are, we're going inside the tendon itself and trying to inject where that tear is. And how's it been? Okay? Any pain since then, or?
Since then, on this hand, no. On the left, no.
So that basically took care of it. Yeah. And you had that problem. He had the problem since January 2014. We did the shot in May. And then when did it get better? Like sometime in June or July, somewhere around there.
I remember.
And it
Didn't
hasn't
take too long.
and it hasn't come back, the pain.
No.
All right, terrific.